What's up, guys? My name is Pat. I'm a 24-year-old New Jersey native, born and raised on the Jersey Shore. I've been thinking about putting together a YouTube channel for a while now. I am a fitness enthusiast. I've been working out for over 8 years now, and feel like I could utilize this platform to really share my wealth of knowledge, the things that I've picked up on, mistakes that I've made in the past. So I train for an athletic physique. My fitness goals really align with looking the best that I possibly can, but also being functional. So I'm an avid runner, but I also like getting in the gym and throwing around some weights. So my training splits typically look about 6 days a week, where I'm doing running maybe 4 or 5 days, and 6 days worth of strength and mobility training. The reason that I'm making this video and really getting started with YouTube, as you can see from kind of the header and the thumbnail, is I recently was diagnosed with a torn labrum in my right hip. So what I would like to do is kind of talk about that diagnosis, as obviously it throws a big wrench in my daily routine and my passions and the lifestyle that I like to live. And I'm sure there's many of you watching out there who are going through similar symptoms or similar injuries that can relate. So first I want to talk about what a hip labral tear actually is, what causes it. Then I'll kind of get into how I discovered that I have a labral tear in my hip. And then from there, discuss my reasons for going forward with a surgical procedure. What is a hip labral tear? So you've heard labrum before, probably in your shoulder. You have labrums in your shoulders, but they're also in your hips. And the labrum is a soft tissue that coats the socket of the hip joint. So picture your hip as a ball and socket, and the labrum is really what seals that ball and socket in place and is the in between the top of your femur, which is one of the bones coming out of your leg, and the socket. By no means am I proclaiming to be a doctor or medical professional, and just kind of sharing based on my experiences and doing a lot of research over the past couple of weeks. So the labrum really acts as a pressure distributor in the hip, as it sits between the top of the femur and the hip socket itself, so that those two things are not touching. It's the labrum in between them that provides assistance in smooth movements between those two structures. So it's an essential component of any movement function. The hips are really tied into pretty much everything. Now I'll talk a little bit about how I found out that I had a tear in my labrum. So like I said in the beginning of the video, I am a pretty consistent runner. So back in the summer of 2020, during some of the rougher months of the COVID-19 pandemic, I was doing quite a bit of running. The gyms in New Jersey were all closed down by the governor. I was really making the best of the situation, doing some at-home training with the limited amount of weights and equipment that I had in my house, and then doing a little bit more endurance training. Got on a program, was thinking about potentially looking to run a marathon, getting my mileage up to really half marathon distances on my long run days. Progressively started to notice some pain in my groin hip flexor area. Naturally, I think my first instinct was I just had a tweaked muscle, or was a little bit tight. So I started to peel back on my running routine, and started more mobility. Weeks went by. I was actually on a family vacation at the shore. Was starting to feel a little bit better from not running as much, not doing as much, and putting as much stress on the hip joint itself, and went for a jog on the boardwalk by the beach, and all of the pain just came back at once. And it was really at that point that I knew that something was seriously wrong. because I'm the type of person, I've never really had a major injury thing. At that point, I got back from that vacation and decided to go see an orthopedic. Basically how insurance companies work these days, they won't allow you to go for an MRI right off the bat. That's what I wanted to do, because I'm pretty in tune with my body and I knew something really wasn't right. But they make you try conservative treatment first. So I began physical therapy for about 6 weeks, and then from there had a reevaluation with my doctor based on the lack of improvement that I saw from PT, that he wanted to go and have that MRI done. So the pain that I was experiencing, I would describe, would not necessarily be like a shooting pain. It was more of a dull pain where it felt like I just kind of had something nagging persistently, and it was correlated with activity. So the more I moved, the more I walked around or ran that day, the worse it would feel post-exercise, to an extent during exercise, but the worst was really post-exercise. When I would go to sit down for a prolonged period of time, it would really start to flare up and be uncomfortable. Driving in the car was uncomfortable. Sitting on the couch watching a movie after a little bit of time was becoming uncomfortable. In terms of other symptoms that I had, started to experience a little bit of lower back pain, as well as a pain in the top of my hamstring, which now I know was really just because my leg and lower back were overcompensating for having that tear. When you get that MRI, and you get to that point, it's an arthrogram MRI, which is not fun. Basically, you have a really long, thin needle that they insert all the way into the hip joint through the side of the hip, and they numb the whole area, but it's still very uncomfortable. And they're inserting dye into the joint to assess whether there's a tear or a loose object, whatever the case may be. The dye acts as a contrast, and it makes it easier for medical professionals to determine what the injury is or where the tear is located. So I got that phone call that nobody wants to get a few days after my MRI from my orthopedic, and basically telling me that I did in fact have that torn labrum, which was crushing news for me. At that point, my mind immediately went to, okay, do I need surgery? How do I get this fixed? Because I really, it had been a couple months at this point, and I really wanted to just get back on track and start feeling like myself again. The conversation that I had with my doctor was really centered around surgery. Two options are to continue conservative treatment, which would be more physical therapy, more cortisone shots, and to stop all activity for a few months to monitor how it responds. The other option is a surgical procedure that they do arthroscopically, which they go in using a camera and basically assess what needs to be done. So in some cases, that is repairing the labrum. In other cases, they get in there and see that there's certain parts of it that are completely detached, and they want to remove those parts. And in other cases, they also have to shave the bones inside the hip joint so that the impingement that was causing the wear and tear on the labrum in the first place is fixed. The technical term is femoral acetabular impingement. That's a mouthful to try and say, but essentially what that means is your bones, whether it's to the top of the femur and or the socket of the hip, are slightly misshaped, causing that kind of wear and tear with the labrum right there over time through pressure, causing that labral tear. In my case, I had x-rays done, and it was determined that I did have some slight misshaping of the bones. So it was not only a torn labrum, but torn labrum FAI is the official diagnosis. So at that point, they really put the decision in your court on if you want to try to avoid surgery and continue with conservative treatment. I've read a lot about people who've had success with continuing physical therapy and overcoming that pain and adjusting and modifying their lifestyle and activity to better support less impactful things. But ultimately, my decision really came down to the fact that I'm 24 years old. I'm an extremely active person. I have a lot of fitness goals centered around exercise, whether that be triathlons, marathons, weightlifting, having to modify my lifestyle and my exercise routines around the injuries. So that was my thought process in deciding that I really wanted to go forward and pursue surgery, because in my head I kind of said, hey, if I try this conservative treatment for 3 months and it doesn't work, I'm still back at square one. So really my push was to get it fixed. You really have to ask yourself, if you receive this diagnosis, is this something that I can work around? And if that's the case, and you're at a point in your life where you don't necessarily need to continue to do other activities that would make your hip labral tear flare up, for example, less impact activities like swimming, biking, things of that nature, maybe conservative treatment is the right course of action for you. I'm not trying to sit here and tell you that, hey, every labral tear should go get surgery, because that's just not accurate. I think there's plenty of people who've had success out there with conservative treatment. That'll be it for today's video. Appreciate everybody tuning in. If you could all do me a favor and like, subscribe, and please leave a comment. I'm sure a lot of you are watching this because you either know somebody who's had this diagnosis, or you've had the diagnosis yourself and you're trying to weigh the options. So as somebody who's currently going through it, please leave a comment. I'm more than happy to answer any questions, make certain videos on things from my experiences that will help enlighten you and give you more insight into the decision and diagnosis that you may have received. So next up will be my surgery video, and then I will make an effort to create one video per week on an update on my post-operation recovery process. So thank you so much for tuning in. We'll see you next time to talk about surgery.